Hello, my name is Jillian Tate, and I am the clinical manager of the Lifestyle Medicine Center, and I am a registered nurse. I am also certified by the American College of Lifestyle Medicine in lifestyle medicine, and I am here to speak with you tonight about immunity and lifestyle. This is something that we've heard a little bit more about since COVID has come around. We've heard statistics about how people with diabetes, and with heart disease have shown to have a harder time with COVID than somebody that is generally healthy. So tonight we're going to talk about why that is and also give you ways that you can increase your immunity by making lifestyle changes. I'm going to go ahead and start my presentation. Okay, sorry, I went a little bit too far. So, what is a chronic disease? So, a chronic disease is defined by the CDC as a condition that lasts for 1 or more years and requires ongoing medical attention, and it's going to limit your activities of daily living. So basically, your quality of life is going to be affected somewhat by this chronic disease. Chronic diseases are the leading cause of death and disability in the US, and they are seen as just a common symptom of aging. But this actually isn't true. Multiple studies have been done comparing people with standard diets and standard unhealthy lifestyles of the same age to people that have adopted a healthier lifestyle, and they've shown that these disease progressions do not have to happen. So some examples of chronic diseases include type 2 diabetes, heart disease, which includes heart attacks, hypertension, high cholesterol. And hypertension is just high blood pressure. And so I'm sure you know somebody in your life that has that. Obesity, heart failure, multiple kinds of cancers are considered a chronic disease. There are some forms of cancers that are generally not as avoidable as others, but for the most part, cancer is an avoidable disease. Alzheimer's disease is another one that can be prevented and is a chronic disease. Arthritis, multiple sclerosis, Parkinson's disease, and strokes as well. So some risk factors for developing these chronic diseases, you'll see that age is not listed as one of them. So your first one is going to be poor nutrition. This is going to be the foundation of developing chronic disease. And it's kind of unlikely that you're going to have all of these other risk factors nailed and you're not going to have them if you have poor nutrition. A lot of times, poor nutrition is going to be a predictor for other bad habits as well. Lack of physical activity, chronic stress, tobacco use, and excessive alcohol use. These last two, tobacco and alcohol, those are huge, huge risk factors for developing chronic disease. We all know the risk of developing COPD or lung cancer with the use of tobacco, and then also liver disease. So we've talked about what a chronic disease is. So now let's discuss what immunity is. So I'm going to give you the actual definition first, and then we'll kind of break it down. So the quality or state of being immune is basically a condition of being able to resist a particular disease, especially through preventing development of a pathogenic microorganism or by counteracting the effects of its products. So we know about immunity through vaccines, especially with the COVID vaccine that's been talked about. So that's providing immunity by injecting the mRNA of the virus into your body and your body building up antibodies that way. You can get immunity by getting a virus or a bacteria and developing your own antibodies. And then you can also just be able to fight off these invaders because your body is like, oh, I am so healthy. I know what's going on here. I'm going to attack this virus before it ever even has a chance to replicate. And I'm just going to go ahead and take care of it because I'm functioning at my highest capacity. So, more easily said, it's the ability for your body to kill an organism before it makes you sick or fight it off quickly if it does. And immunity is very, very complicated. There's so many different types of cells and ways that it's attacking the virus or the bacteria. That is saved for another day, maybe a biology class. But just simply put, it's just your ability of your body to be able to kill an invading organism. Immunity also comes into play when dealing with cancer. And this is why I said that cancer is considered, in a lot of cases, a preventable chronic disease. So, a high functioning immune system can basically notice these cells that have kind of gone rogue, you could say. We all have cells that are mutating and have the potential to become tumor cells all the time. But the thing is, our body is healthy, our immune system is functioning properly. And so it recognizes these cells and is able to take care of it before it replicates and divides, causing a tumor or cancer. So, whenever your immune system is not functioning as well as it could, then it's not catching those tumor cells and they're able to rapidly divide. And then that's whenever you develop cancer. So, immunity and chronic disease, how are we going to connect these two together? Basically, the bottom line is a body experiencing a chronic disease is just not well. You're not healthy, you're not functioning at your best capacity, and essentially you're sick. So chronic disease frequently causes chronic widespread inflammation throughout your entire body, and this causes your immune system to be compromised. Damaged organs are then more susceptible to further damage and find it harder to recover. So we'll look at the easy example of the coronavirus. The coronavirus invades your body, your immune system is weakened because it's just used to your body having chronic inflammation and chronic disease processes going on. So it's not able to take care of that virus and keep it from replicating. So the virus is replicating at a very quick rate and you're getting symptomatic. Well, your symptoms are going to be shortness of breath and coughing. Your blood oxygen saturations may go down. And so if you already have diseased lungs or you already have a diseased heart, then this lack of oxygen throughout your body could lead to a heart attack, or the lack of oxygen could lead to respiratory failure very quickly because your lungs were already very sick and your body is sick in general, so it's not able to repair itself. So what can you do about this? I want you to really focus on healing your body from the inside out if you already have been experiencing chronic disease. If you have not been experiencing chronic disease, then I want you to focus on either maintaining the current state of health of your body or improving it to keep it from progressing to chronic disease. So I want you to think about it this way. If your arm was broken, you would fix it, right? You wouldn't just keep taking pain medicine so that you could deal with the pain of your broken arm and then go about your normal life for 5 or 10 years. Of course, we wouldn't do that. So, why is chronic disease any different? Why do we feel like it's okay to take all this medicine that's prescribed to us and put a band aid on what the actual problem is? The problem is our body is sick and we need to fix that. We need to heal it before we can be functioning as a healthy adult and keep from developing more chronic diseases or being susceptible to these viruses and bacteria. So, lifestyle medicine is actually the only way to heal your body, improve your immunity, and guard yourself from future pathogens and disease. You can take all the medicines in the world for your diabetes or for your heart disease, but you're not going to heal your body. You're simply masking the symptoms and you're able to deal with the symptoms to get through your everyday life until you run out of medicines to add, or all of those medicines cause so many side effects, you can't continue on with your daily life anymore. So I'm going to tell you how you can heal your body, improve your immunity, and guard yourself from future pathogens and disease. So, what is lifestyle medicine? I said it was the only way to cure it and to reverse disease, to improve your immunity. So, what is it? It is the use of evidence-based lifestyle therapeutic intervention, including a whole food, plant predominant eating pattern, regular physical activity, restorative sleep, stress management, avoidance of risky substances, and positive social connection. This is delivered by clinicians, by a doctor, by nurses. They've been trained in this specialty. I told you I am certified. I took a very hard test to make sure that I knew what I was talking about. I'm not just coming on here because I read a blog post and I think that this is going to help you. We are trained medical professionals. We're not just somebody off the street telling you to do something. And that's very important. And I want you to remember that. But so we teach you how to use these 6 pillars to reverse your chronic disease. And this is used in conjunction with conventional medicine, and it's actually the foundation of conventional medicine. So we're not going to tell you, hey, you know what, just start eating plants today and reduce your stress level, and I want you to stop all of your medications right now. We're not going to do that. We want you to continue along your current treatment plan and work on improving these 6 areas of your life and get to that point where we can start reducing your medication. We can take you off. If you dedicate yourself to this lifestyle, that is possible, but we're not telling you to do it in lieu of your current treatment plan. We work with your physician and we work to do this in a safe manner, not a way that's unsafe. So lifestyle medicine allows the body to protect and heal itself by promoting healthful lifestyle choices. It educates, guides, and supports positive behavior changes, places a focus on evidence-based optimal nutrition, stress management, sleep, and physical activity. It encourages active patient participation. We want you to be a part of your care. We don't want you to just listen to what we tell you. I know on a lot of our programs, we get people that are just like, okay, can you guys just give me a diet plan? I'll follow your diet plan. Just tell me what meals to eat, tell me what time to eat, tell me how much of it. But we don't do that because we want you to be making these decisions. We want to teach you and give you the tools to take control of your health. If we just tell you for 12 weeks what to do, then after the programs and you're done with us, then you're back to square one and you are back to your old behaviors. So we are going to teach you how to be an active part of your care. We treat the underlying lifestyle related causes of disease. We use medications to supplement therapeutic lifestyle changes. And we consider the patient's home and community environment. We know that everybody's situation is unique. We know that not everybody has access to the same things. So we take your unique situation into account when we're developing a plan for you. So I've talked about the 6 pillars. I kind of briefly touched on them, but let's go over them specifically. What are the 6 pillars of lifestyle medicine? So first we have healthful eating, which I mentioned was primarily a whole food, plant predominant diet. Physical activity, we're going to go over that into detail. We want you to increase your physical activity and make it a focus. We want you to develop strategies to manage your stress, especially in our world today. Everybody is just so chronically stressed, and stress lowers your immune system. There are a lot of viruses like HPV, for example, that can be lying dormant in your body. And whenever you are in a chronic state of stress, your immune system kind of lowers its guard a little bit, and the virus is able to replicate and start causing havoc, even though it may have been in your body for 10 years. Avoiding risky substances, improving your sleep, and forming and maintaining relationships. So let's talk about nutrition a little bit. I say a whole food, plant predominant diet, but what does that mean? It means you're getting in whole grains, you're cutting out refined grains. You're not going to have the white bread, the crackers, the white pasta, the Cheez-Its, the goldfish, none of that. It's all gone. You're going to focus on fresh whole wheat breads, whole wheat pastas, brown rice, quinoa. Those are all great forms of whole grains. Fruits, vegetables, legumes, and beans. And then you can also get in tofu and tempeh as well. Tofu is just a soy product, and tempeh is the whole bean version of that, and it's a great protein source. You're going to focus on reducing the intake of added fats, oils, sugars, and salts. These are everywhere. You can go to the store and look at your favorite pasta sauce, and 9 times out of 10, there's probably sugar in it. Why is there sugar in pasta sauce? Just to make everything more addicting. It's kind of ridiculous. So you're probably getting added fats, oils, sugars, and salts without even realizing it at all. We want you to eat the rainbow to ensure you're getting your vitamins, minerals, and antioxidants. And we'll touch on the antioxidants here in just a second. And then I want you to stay hydrated. So a goal for men would be 15.5 cups a day of water, and a goal for women would be 11.5 cups. Some people can say drink your body weight in water, drink half a gallon of water, drink a gallon of water. Shoot for this goal, increase as you can. Most people are not even coming close to this. Teas, coffees, things like that, they don't count towards your water intake. We're talking plain water here. So antioxidants, what are these? So they are found in plant foods, and they play a huge role in immunity. So just a simple explanation, your body just in its normal processes like breathing or healing creates something called a free radical. And so these antioxidants bind to these free radicals, and it basically causes neutrality so that you're not being harmed by these free radicals. So you want, obviously, enough antioxidants in your body to be able to take care of all of these free radicals. So they aid in immunity by protecting the cell response, the cells responsible for the repair of damaged cellular DNA. They encourage the production of white blood cells, and they protect immune cells from environmental damage. Okay, so moving on to our second pillar, that's going to be physical activity. So we want you to be getting regular, moderate physical activity. What does this mean? So it means that you're doing a level of activity where your heart rate is rising and it's a little bit difficult to talk and carry on a conversation. We don't want you so winded that you can't talk, but you should have to work to be having a conversation during this activity. So as little as 20 minutes a day can suppress inflammation and support immunity, but we actually recommend you get at least 30 minutes of moderate activity 5 times a week. Even on your rest days, we want you to keep moving. We don't want you to just sit on the couch all day. Maybe that day you take a lighter walk, or you toss the ball around with your dog for 30 minutes or something like that. We want you to still be moving. And physical activity does not have to be organized. So you don't have to actually go to the gym. You don't have to do a workout class. We just want you to be up and moving. So if you enjoy hiking or if you enjoy going for a jog, then go ahead and do that. You don't have to go to the gym and lift weights in order for it to be considered physical activity. You don't have to jump on a treadmill. Make sure it's something that you enjoy and that you like doing, because if you're dreading doing it, then you aren't going to want to make it a part of your routine every single day. And then also another thing to remember is that this should be in addition to your normal behaviors. So I know a lot of times I talk to patients and ask them about their physical activity, and they're like, oh, well, I work in construction, or I do this or that. That's a physical job. Well, your body gets used to that. And so if you're doing that every day, it kind of realizes, hey, this is our normal routine. And it doesn't count it as exercise anymore because it's so used to having this. So I want you to be intentional. And even if you do have an active job, I want you to include that extra activity in your daily activities. So stress management. The hormone cortisol is going to be the big factor here. It's what's going to suppress your immune response. And when you are stressed out, your cortisol levels spike up. So we want you to focus on deep breathing and guided meditation to reduce your stress and to relax. Being mindful, even just in small doses, if you take 5 minutes, it can really reduce your stress. So during your workday, if you can just take 5 minutes just to listen to a guided meditation, some great apps are Calm and Headspace. We have some guided meditation on our LMC site, on our Facebook page. And then also YouTube has a lot of free guided meditation, or even just taking 5 minutes to just sit and close your eyes and breathe, or maybe do a journal entry, or maybe just reading, just whatever reduces your stress and works for you. And that's different for everybody. Not everybody can do the same thing and get the same results. So find out what works for you and try to incorporate it, even if it is a small amount. Just take 1 minute to breathe. I know my Apple Watch reminds me sometimes. It's like, hey, you really need to take a breath. So that's a good way to be like, okay, I do. I'm just going to sit here. I'm going to close my eyes and I'm going to breathe for a second. So you can also learn to recognize negative stress responses and replace them with more conducive reactions. So I know that I have 3 young children. I work full time. My husband works full time. They're in activities. I can get stressed very, very easily. So whenever I start to feel that building and that anxiousness of, oh, I only have 5 minutes to get here, the kids won't get in the car, I can't get them buckled in their car seats, yada, yada, I have to stop myself from going down that path. So if I realize, hey, you're allowing yourself to get worked up, whether you're worked up or not, you're going to get to this place 2 minutes late, regardless. So just take a second, relax, speak calmly to the children, speak calmly to yourself in your head, realize life goes on even if you're 2 minutes late, and just relax. Stop those negative stress responses, keep them from happening. I know that's easier said than done. I get it. But I really want you to just next time stop and think, what's the worst thing that could happen? So muscle tension, an upset stomach, headaches, and difficulty sleeping are all signs of stress. So whenever I'm screening people and I'm talking to them about what's been going on, a lot of times people downplay how stressed they are. They think, oh no, things aren't that stressful. I haven't had any big events go on. But then they are telling me that they're having to take Prevacid because their stomach is always upset. They get these headaches 5 days a week that they just can't get to go away. They, excuse me, they're so tired all day, but then they lay down to go to sleep and they can't shut their brain off. These are all signs of stress, and these are all signs that your body is not well. So it is up to you to find a way to manage the stress. More than likely, your stress is not going to go away. The stressor, the actual event, is not going to go away. We don't have control over our lives. Things happen to us. Day to day things happen to us, but we control how we respond to those events. And that is in our power. So I really suggest that you look into deep breathing, look into guided meditation, and find a way to help yourself relax. Maintaining healthy relationships. This one's a really big one. And I think a lot of people found out how important this was to them whenever we went into quarantine and we weren't able to do those things that we so often take for granted. So reach out to your friends and your family members, your coworkers, call them, email them, text them, send them a Facebook message, um, post something for them to see on social media. Um, Also get creative. I think quarantine helped us think of new pathways of seeing people. So we weren't able to see our neighbor. So we started Zooming our neighbor, or they had these like online where you could play a game with one another. Um, I forget what it was called, but it was really cool. It was like this platform where you could play like a board game type thing with people. But so that kind of goes to show that it doesn't matter how far you are. So you may have family that's in another state, but that doesn't mean that you can't see them. Schedule normal or regular Zoom meetings once a week. Have dinner with them on the weekends. If your mom lives in another state than you, do have her cook a dinner, you cook a dinner. Maybe it can be the same dinner. You guys can talk about it and eat together and just chat. I think we've learned this last year that you don't have to be in close proximity to someone to still have those healthy relationships and those connections. So get creative. And then if you're lucky enough to have everybody you love close by, organize a weekly game night. meet up for dinner, get together on a weekend for all of the kids to play. Just really focus on maintaining those healthy relationships, because I think once we become adults and we get our own families and we have all of these priorities, relationships are kind of put on the back burner because it's just seen as an extra perks, like, well, I don't have time for friends. But friends are important. Humans enjoy having friends and relationships with people. They're Most people are not wired to be in solitude. So just make sure that you're putting an effort towards that, because it'll really make you feel better. Optimizing sleep. This is another one that gets put to the back burner because we're so busy. We think that we don't have time for sleep, or it's more important to get things done than it is to make sleep a priority. But I want you to aim for 7 to 9 hours of sleep each night, and develop a routine to do this. If you're doing the same thing nightly, your body kind of gets primed up and it's like, okay, it's bedtime now, and it kind of starts naturally getting a little bit sleepier. If you have trouble with getting busy in the evenings and forgetting when it's time to start winding down, maybe set an alarm that reminds you, hey, it's time to start my bedtime routine now. And obviously, you can set alarms to wake up. I think most of us probably do that. Make sure your room is cool, dark, quiet, and comfortable. Avoid screens for at least 90 minutes before bedtime, preferably more than that. And then practice a wind down ritual. So that could be listening to music, writing in a journal, reading a book, doing your skincare routine, just something that is prompting your brain to think, okay, now it's time to go to bed. Let's get in that relaxation state. And then I would suggest not watching TV in your bed. Keep your bed for sleep. And then I think the one that is kind of the most obvious and we all know to do to stay healthy is avoiding risky substances. Avoid smoking, vaping, inhaling any kind of substance because it's toxic to the lungs. Don't use alcohol as a stress reducer. Don't use it as a source of phytonutrients. I know I get that one a lot, but isn't red wine healthier? Well, yeah, but it would be healthier just to actually eat some grapes. The alcohol really has no benefit. These substances can cause liver disease, heart disease, and cancer. So that brings us to the end of our presentation. If you guys have any questions, please post down below or feel free to email me at billion.tate@midlandhealth.org. You can also call us at 221 Life, and Mackenzie, she is our amazing physician office coordinator. She can connect you with me and I can answer any questions that you have. We want to help you increase your immunity and lower your risk of disease. It is very possible. It does take a lot of work because you're undoing a lifetime of unhealthy habits, but it's doable. We have people do it every day. We have such amazing stories. And you can find some of our testimonials on our Facebook page as well. We have so many unique options to fit specific needs. So if you're diabetic, we actually have a diabetes reversal program. It is a 12-week program designed to help you treat and reverse your diabetes. Our hope is to get you in the state where you can get off of your medication or at least decrease your medications. We have a weight loss program if you're overweight, and that is a cash pay option. So we don't go through insurance or anything like that. It's a one-time fee. You get labs at the beginning, labs at the end, 12 weeks of instruction and health coaching. We also just have health coaching. If you feel like you understand a whole food plant-based diet, but you just need somebody to hold you accountable and help you work through some things, we have options for that. We have our amazing dietitians that you can meet with one-on-one, and we have Dr. Patel's clinic. If you have heart disease, then you can ask your cardiologist to write you a referral for our Pritikin intensive cardiac rehab program. So as you can tell, we have lots of different options. Obviously, you found this class, so you know about our Thursday lifestyle medicine classes, and these are free. So many things that we have already, so many things that we plan to develop in the future. We're always open to suggestions. We want to do whatever we can to serve you guys and to help you improve your health. So thank you very much for listening to me tonight. I hope that you have learned a little bit more about immunity and how your lifestyle affects that. Chronic disease is a huge problem. It's a huge, huge, huge source of debt for our country because of all of our medical costs that are going towards chronic disease. And then personally as well, how much money are people spending on procedures, hospitalizations, monthly medications, supplemental insurance? All you have to do is change your lifestyle, focus on these 6 pillars, and we can help alleviate all of that stress from medical costs and um, health stress as well. So, thank you so much for listening tonight. We hope to hear from you at the Lifestyle Medicine Center. Please comment below any questions you have. Share this with anybody you think that could benefit, and we will see you next time. Thank you. Bye.